Can you see me over the thing? I'll joke about that probably every time.
I wish we had one.
Because it's funny. That's okay.
Okay.
It's all good.
Yeah,
Ready?
you're ready.
Okay. Okay. It was frustrating to know that I was going to have to change things about my life that I wouldn't have had to change before. These are words from my neighbor, boss, and friend, who his name is Alan Brown, and was diagnosed with a form of Crohn's disease known as ulcerative colitis at the age of 28. Now, being 41 years old, he still has to deal with some of those aspects of the disease today. I forgot my little credibility thing back there, but it's just my lab coat from nursing school last year at Texas Tech, and I learned a lot being submerged into the clinical world and learning a little bit more and being surrounded by people that are suffering from it or families that have family members with it. I feel pretty educated on it. So what we're going to be discussing is what exactly Crohn's is, who it affects, and obviously some treatment plan / prevention for that. Now that you know what we're going to talk about, let's start with what exactly Crohn's disease is. Crohn's disease is a chronic inflammatory bowel disease that causes ongoing inflammation in the intestinal tract. Similarly, ulcerative colitis is also an inflammatory bowel disease, but it's mostly targeting on the innermost part of large intestine and the rectum, which is according to the University of Maryland Medical Center. As mentioned, they're both located in the intestinal tract, which ends up affecting what you can and can't eat. In an interview I did with my friend Christina, who also has Crohn's, she said that what she ate affected how she felt daily. So she hasn't had lettuce since she was 12, but she did admit that she sneaks a Snickers every now and then. Crohn's is mostly hereditary and usually skips a generation, according to Alan, who I interviewed as well. According to eMedicine Health Online, approximately 7 out of 100,000 people are diagnosed with Crohn's a year, which is one of the most high rates in the United States. It's also more prevalent in whites than it is in African Americans and Asian descents. Now that we know the difference, we can talk about who exactly it affects. Crohn's can affect anyone at any time. Could be you, could be me. According to eMedicine Health again, it's most common among men than women, and mostly newly diagnosed individuals are between the ages of 15 and 30 and 60 and 80, which this picture up here is my boss, Alan, probably around the time that he was diagnosed. He was jump-starting his dog training career at this time, and he said, in quote, that he had to plan his travel routes to work on where he knew every single restroom stop was along the way because he didn't want to worry that he was going to have to use a restroom. So I can't imagine how stressful that would be. Christina, also I interviewed, was diagnosed at 11, and to see how her family felt about her being diagnosed, she said that her parents became very protective of her. Christina is the one on your left. So when she started rebelling and not wanting to take her medication, that really stressed her parents out. Now being 27 years old, she realizes the importance of having to take that medication to regulate the inflammation and the flare-ups. Now that you understand that it can be you, let's talk about some treatments. There are different medications available, such as the ones listed there. Prednisone and Asacol are both steroids that prevent inflammation and the swelling of the intestines, which I didn't have to look up because I actually remembered. And Flagyl is an antibiotic to help with infection. According to the Mayo Clinic, limiting dairy products, trying low-fat foods, and limiting your fiber are also ways to decrease flare-ups. Other suggestions by that clinic as well are cessation of smoking. That's a really big one. Pretty much with any disease you have, if you are a smoker, the best thing to do is to quit. As well as avoiding stress. Christina admitted in the interview as well that when she feels like she's about to come up on a confrontation or an altercation, she's learned to walk away because she understands that the stress of that really makes her feel bad. And that's why I put a picture of shopping, because that kind of helps me relieve stress. In Understanding Crohn's and Ulcerative Colitis, a book that I looked up, it said surgery is curative for those with ulcerative colitis, and surgery is life-changing, so it shouldn't be taken lightly. Ultimately, Christina taking the medications for the Crohn's is helpful for her to stabilize the Crohn's, but for Alan, surgery ended up being his only option to live a normal life and get rid of the diseased part of his intestines. And those two medications, Flagyl and prednisone, were two medications by both parties that verbalized to me they were both prescribed, so pretty common. To sum it all up as I have here, it is possible to have a normal life with Crohn's and ulcerative colitis. As you see Alan in this picture and the top picture, that's Gumbo the dog. We love Gumbo, he's sweet. And that's him fishing, and he has a pretty normal life. Seeing him without the disease, he's a pretty happy person. And Christina, and that's me and them. But ultimately Crohn's comes in other forms, like I mentioned, ulcerative colitis. Although there's not really means of prevention, at least there's medications and surgeries available. I'm thankful that I no longer have to worry about which routes to take, and that the doctors were able to help me live as normal a life as possible. Also, words of Alan. So it could be you. Take care of yourself.